Well, good morning, and thank you so much for being here. I'm here with Dr. Mike Shepherd, the Group Director of Operations for Health New Zealand in the Auckland District. And today I'm pleased to announce that Health New Zealand will be delivering an additional 75,000 diagnostic procedures over the next year through its $65 million Diagnostic Improvement Plan. Around 40,000 New Zealanders are waiting too long for critical diagnostic scans such as MRIs, CTs, colonoscopies, echocardiograms and colposcopies. Those New Zealanders are needing answers to what's wrong, and with those delays it's leading to anxiety for patients and their families, while also holding up treatment and adding pressure on our hospitals. This investment, but also importantly this plan, will expand access so that patients can get answers sooner, doctors can diagnose problems earlier, and treatment can begin quicker without delay. And for many New Zealanders, this is going to be life-changing. Over the next year, the program will deliver an additional 74,950 additional procedures through both public and private providers, including 64,000 additional radiology procedures, that's CTs and MRI scans, 7,100 additional colonoscopies, 2,200 cardiac tests, and around 1,650 colposcopies. These scans, these tests are going to be critically important to help patients getting diagnosed with things like bowel cancer, colposcopies for cervical cancer, radiology procedures for other important diagnostics. We're also investing in the workforce by expanding training places in radiology and echosonography to meet future demand. This initiative is also in addition to the $30 million investment in community referred radiology, which has recently been launched by Health New Zealand, which supports GPs to be able to refer directly patients for these scans, both through the public health system or to private providers, to cut out unnecessary waits. This is about putting patients first, faster access, faster answers, and faster treatment. And with that, happy to take questions.
Minister, is this a new announcement or is this a re-announcement?
No, it's a new announcement, so it's a new plan, and I can get Mike to talk to the work that's been done putting this plan together. Ultimately, the number of New Zealanders waiting for diagnostic procedures has been increasing. It's not good enough, and this plan has been designed with clinicians across the country so that we can increase access to these critical diagnostic procedures, speed up access to answers, and that means getting patients the treatment that they need sooner. But happy to get Mike to talk to the work that's been underway to put this together.
Minister, just
Sure.
quickly on... Oh, sorry.
Mike wants to...
Oh, okay.
Yeah. So look, I think this is critically important for our patients. Timely access to tests. Patients have been waiting too long for these really important tests, and we're really focusing on the CTs and the MRIs, the echocardiograms, the things that are really life-changing for patients through their pathway of care. So this is definitely an extra boost in our diagnostic delivery. It supports our boost in our elective plan, and it really supports the community referred radiology program that we've got, as Minister mentioned, around primary care. So these things come together, and we built this as an integrated program, building capacity within our system at the same time as delivering increased diagnostic tests.
Minister, the $65 million, where's that come from?
Well, two places. Part of it's come through efficiencies in the outsourcing budget, so being able to do better deals, we're able to then make further investments. And secondly, a pool of money that was set aside as part of our $1.37 billion uplift in funding for Health New Zealand in the budget to support our health targets. And so this is critically important to meeting our health targets. Diagnostics is an important part of making sure we get faster cancer treatments. It's critically important so then we can diagnose and get people the elective treatments they need. It's also really important for those emergency departments in making sure that hospital flow is being facilitated, because a large number of patients end up waiting either a long time in emergency departments or in a hospital bed because they need a CT or an MRI. So speeding up access to those treatments helps us support those critically important health targets, which we know save lives.
Minister, the Apex Union recently put out some figures around this, and they called Health New Zealand's response lethargic to the radiology crisis. Is this your response to this?
Well, we have, I've said in the press release that you've seen today that I expect Health New Zealand to work closely with the Apex Union to make sure this investment is successful. They have raised a number of really important points in that report. I read that report. I met with the union, and I believe this boost in terms of diagnostics does address a number of their concerns which they have rightfully raised. And as I said, I've asked Health New Zealand to work closely with that union to make sure that this is successfully delivered for patients. And as I said, it's about maximising capacity across Health New Zealand, also working to outsource where needed, so that patients get faster access to answers, which then leads to faster treatment, which is so important for patients.